Hello and welcome to a very special COVID-19 episode of Checking the Vitals, a podcast powered by SpecialtyCare. In this conversation, we talk to Denise Wetsch, Keaira Howard, and Arizbe Sanchez. They are traveling clinical technicians at SpecialtyCare. We discuss what made them want to get one-way tickets to Everett, Washington to help out for as long as this COVID-19 outbreak lasts, how they are staying close to loved ones during this time, and how the Everett community is helping support their clinicians. Enjoy the conversation. So thank you guys for joining us. I really appreciate all three of you joining us here on the podcast. And I really wanted to talk to you guys about sort of the situation that you're going through, but also sort of how you ended up there. And that sort of starts with what you guys do day to day. So can you, one of you guys, sort of walk me through what your job function is day to day at work?
Well, currently, the three of us were part of the implementation team at SpecialtyCare. And we support all minimally invasive surgeries, the ones with using a rigid scope. So any surgeries that they use that rigid scope, we would be in the OR, supporting the video system, making sure everything's working, troubleshooting, and also support the staff with instrumentation. The complex instrumentation is kind of new, not really new to everybody, but a little kind of taboo. They don't really like to work with it. They don't know a lot about it. So we help them with that part of the surgery. We also work in decontamination with those complex instrumentation, cleaning and decontaminating, processing, setting, make sure that everything is working, and pack it up and send it to sterilization. And we do that over and over and over again.
So you guys are sort of an end-to-end solution for these very intricate scopes that are used in surgical procedures. So everything from technical support to cleaning the scopes at the end of the day, or really, I guess, in between surgeries.
Correct. Scopes and all the instrumentation that they use.
Okay. So are you guys actually in the OR while the surgery is going on as well, just in case something goes wrong with the camera equipment that's attached to these scopes?
We are.
Oh, wow. So that sounds like a very, very long shift to me, just because some surgeries can go hours and hours and hours, and then you're responsible for also cleaning them afterwards?
Correct.
Oh, wow. That sounds like a lot that you guys have on your plate. So I'd imagine that you guys trade off your shifts, right? So like someone might start a surgery and then someone else might come in and clean the scope, or is it you're just there throughout the whole surgery life of that one scope?
It varies, but we do switch off. So we kind of take turns processing, decontam, and also in the OR. So we're responsible for the entire shift that the hospital has us here for, and we will switch out working in different departments. But they can be long surgeries, it can be long days, but every day is different. Every surgery is different, even though they are the same surgeries we're in, but every day, every surgery is different.
I think if you talk to a surgeon, they'd say the same thing about even surgeries that they've done over and over and over. Everyone's very different. So if you don't mind me asking, what is this workload like in a regular hospital? How many technicians? In fact, what do you guys call yourselves? Like, what is that job title referred to as?
Clinical technicians.
So how many clinical technicians do you guys have for any one hospital, just generally speaking?
It varies, obviously, depending on the amount of cases and the number of ORs that each hospital has. But it varies anywhere from 4 to, right now, we're going to have 8 here at Providence. And Keaira, how many was the largest?
North Carolina was the largest. We had 9 in the OR and 4 in decontam. They would just stay in decontam and turn over because our case rate there, we were doing 50 to 60 cases a day. So we needed that extra support in SPD to be able to manage the OR and also SPD at the same time to make sure that we were turning the trays over and the cameras over in a timely fashion, really.
Sure. And let me ask that, just because that's a little bit different than the setup you guys have, I think, at Providence. When you have an SPD person who's just responsible for cleaning this very intricate equipment, are they specifically trained to clean just the scopes, or do they clean sort of everything?
They clean everything from the scopes to the instruments. And, even we know like that since there was only 4 of them, it would get, tiring for them. So even us technicians, we would go and rotate in with them. So they were able
Yeah.
to go take a break and go to lunch, go eat, go do something,
Sure.
because we know that working in SPD can be just as tiring, if not more, with the OR, because, you have your nurses or surgeons calling, asking like, hey, when's that tray going to be turned over, even though they just finished. So we would help out there, and it was a real good support system.
Yeah, I actually had the benefit of actually a former podcast guest, Greg Agustin, invited me to come look and like get video of someone actually cleaning one of these scopes, and I was blown away with how difficult the cleaning process is. Because I think most people think of, when they think of people in the SPD who literally clean instruments all day, they think of it like like a restaurant dishwasher, but it's so different from that. Like you have to be so technically skilled at each one of these scopes. The lady I watched clean that day was cleaning 3 different scopes, and there were 3 different processes for each of those scopes. It was insane how much knowledge she had to have to just be able to clean something. And if you don't mind me getting into this, what are some problems that can occur if you don't clean these scopes the way they need to be cleaned every time?
Well, the main problem would be infection rates in their OR would go up, obviously. And for proper cleaning and handling, these scopes are very expensive to repair. And we take that burden and are highly trained to make sure the care and handling is properly done, so that there isn't a huge repair cost for the hospital.
Yeah, I'd imagine that having someone like you that can both troubleshoot in the OR and clean the devices is a huge win for any sort of hospital system or hospital by itself, just because you guys prevent longer stays in the hospital if someone gets a staph site infection or something like that, but also you protect the equipment. So like the equipment's very expensive, so you guys have to be able to take care of it. And if it's just getting thrown around by people who don't quite know how to handle it, you can break it. They're very small cameras in these things, and it's just, they're very intricate and awesome pieces of equipment that are very, very expensive. Yeah, that sort of brings us to what you guys are doing now. So as you guys mentioned, as Keaira just mentioned, you're from North Carolina, correct?
No, I'm from El Paso, Texas, but I was in North Carolina for about a good 4 to 5 months while we were trying to find help or new people to bring on board with us.
Okay, and that's sort of what you guys are doing at Providence in that Seattle area, or what city was it again?
Everett.
Everett, yeah, because all you guys are from all over the country, correct?
Correct.
You're from El Paso. Denise, where are you from?
From North Dakota.
And Ari, where are you from?
Keaira's neighbor.
Oh, really?
I live in Sunland Park, New Mexico, but it's a state line with El Paso, Texas.
Okay, so you guys are sort of not from the the Everett area, and you've sort of flown in to sort of help that hospital. So what was going on that I guess required you guys to literally fly in from across the country to help this one hospital?
Todd, it's kind of our job.
Yeah.
They contracted us to help them out with their MIS needs and kind of improve the quality here at Everett.
That's awesome. So you guys were brought in to just sort of help with, I guess, just the scope management piece of it, like all of it, technical support to cleaning, all of what you guys can handle, you're doing there?
Yes, all of it.
Awesome. Obviously, we're sort of in this very touchy time period with, most people being told to shelter at home if they're non-essential. And like for me, I'm not essential, so I'm at home right now. But you guys are having to both travel from various cities and also go into work every day at a hospital. So what was it like to travel from Dakota or New Mexico or wherever you guys were coming from at that time? Like when you guys flew to where you are now, were the airports just ghost towns?
Yes, they're very deserted right now, and it's not what you're accustomed to seeing in an airport. Just busy, restaurants open, everything's closed right now.
Yeah.
You hardly see people. Everybody's trying to keep the 6 feet distance. It's just amazing how big of a change it is now.
Yeah, in a matter of a month, it went from regular day-to-day work to more or less everybody except for essential people not even going to airports, not even going into work. I think that has been the biggest shift for me, has been like the only time I ever go out, and I get excited to go out to like go to the grocery store. I'm like, yes, I got to go get food. But for you guys, you're leaving every day. I don't mean that like as a, aren't you guys so lucky you get to go to work every day? I mean that in a way of like you guys are putting yourself at risk every day to go to the hospital where, I mean, even though you may not be working directly with these patients that are sick with COVID-19, but you're working in a place where they are and your risk is higher to catch it just simply because of that, right? So
Correct. Yes.
what sort of precautions are common or that you're seeing there, maybe at your hospital or the hospitals you've come from in the past? Like what are hospitals doing to protect even people who don't necessarily work with the COVID patients every day? Because I'd imagine that's a higher sense of, and maybe security isn't the right word, but protection, like PPE type stuff.
Yeah, like the biggest change that we noticed as soon as we walked into Everett is it's kind of, there's maybe 2 entrances that you can go through, and at both entrance there's a checkpoint really, and they're taking your temperature, they're asking you, I know at the airport too, they were taking your temperature, like they're asking you where you're coming from, do you have a cough, do you have a running nose, have you, in Ohio, they were even asking us, have you been around somebody that's been exposed to COVID-19? And, at that point, it's kind of hard to say yes or no because, people that have been affected, they show no symptoms, they go somewhere and symptoms take anywhere from 7 to 21 days. So it was kind of hard to say yes or no because, yes, you want to go into work, but you're like, I really don't know. I can't say yes or no to that question because the truth is you just don't know because you don't know where those people have been and who they've been around. So I think a checkpoint really is the biggest thing that I've noticed different.
The hospitals, you see the staff, but same as always, like some wearing their mask, and it's very like just like in the airport, there's really no people here. They're taking a lot of precautions just to make sure not to let just anybody in.
Yeah, now that she brings that up, when we were waiting for our flight, me and Adi, going here to Everett, we there was a table and it actually had some sheriffs there, and as people were deplaning, the sheriffs were asking them like where were they coming from, what was their original flight, and based off of their answers they were sending them to a whole nother section and they had to go over there and get screened for temperature, cough, and all that, and then from there they were sending them off to another room. So I was really blown away by that. I thought when that was really different because I was like, wow, they have law enforcement here to try to screen people in and out when they've already been flying all over the place.
Yeah. Was that in Seattle when you flew in, or was that from one of your other flights?
This was in El Paso. We were headed to Seattle, and they were screening the people as they were deplaning just coming in, and then that was the plane that we were about to get on. So they wanted to know all these questions before they allowed us to get on that plane because they needed to know if they needed to have another plane in the hangar come out, or if it was okay for us to get on that plane.
Oh wow! So even from a cross-contamination standpoint, for lack of a better term, if someone came off experiencing symptoms, they would have gotten you a whole nother plane, it sounds like.
Yes, sir. Yeah, the pilots from that plane had to wait off to the side and sign off if it was okay to have that plane, or if they needed to bring one from the hangar. So I thought, that's pretty neat that they're taking that extra precaution because that's something that they typically don't do. You deplane and they're ready to get more people on the plane so they can get going to where they have to go.
I think what you just said there was very interesting because I think a lot of people would look at this sort of time as a inconvenience, sort of an annoyance, if that makes sense. But and sort of like you conveyed there, I'm sort of blown away by what everyone has been willing to do and sort of go through to help stop the spread and to lower the curve. I'm sure you've heard that, right? So it's been very interesting to me to see that people that do need to go into work, they're sort of gung-ho on going into the hospital and like, I want to do my job. I want to go in there and do this. I would like to think that if I was in that situation, I would feel the same way. I just am blown away by people who actually work in the hospital, their willingness to go sort of put themselves at risk every day. And when I say that, I don't mean like you're definitely going to catch it and you're definitely going to get it. It's not that drastic, but it is. I mean, you're a lot higher risk than I am sitting here in my closet to block out the sound, right? Let me ask this. How long have you been in Everett at this hospital?
This is our first week.
Okay, first full week?
Right.
I know a lot of the procedures that use the specific scopes you guys are using are more elective procedures. And with COVID-19 coming in, a lot of elective procedures have stopped. So has that lowered the workload, or am I just mistaken? Are there some procedures that a COVID-19 patient might need that you guys would be required to be there for.
Absolutely. There is that risk, and those people need those surgeries. So there's not as many, obviously, but we will come across some as we continue working here. So
is there a type of surgery or a type of procedure that would require one of these scopes? I don't even know of any surgeries that are happening for COVID patients. The process for them seems to be ventilation, and then the last ditch effort is ECMO.
Yeah, you're correct. It varies. It can be any type of surgery. And there are patients who have cancer that need some type of surgery. They may have COVID.
Right.
There's an elective surgery, even taking out an appendix that needs to come out, and they may have COVID also. So it's not really surgery for COVID patients. It's surgery for other things that they need, and they may have the virus.
That's, I guess, what I didn't consider. When I think of elective surgeries, I think of things that you don't have to do, but there are some things that I think in my mind would be elective surgeries that are urgent, like your appendix bursts, things like that you have to address. You can't sort of put that off for a month or two, right? So those sort of things still happen. I guess I just wasn't thinking of it that way, but that makes perfect sense. Is your hospital doing anything to keep the COVID patients isolated from the rest of the hospital?
They are, I'm sure. We're not too involved in that process, but I know they are taking some high precautions.
Okay. When this thing first started, a lot of people that worked in hospitals were having trouble getting enough protective equipment. Is that something that you guys have seen there?
It hasn't been too much of an issue right now.
I know that was happening in the first 2 weeks of it. And of course, a lot of people were changing what industries they are in to sort of help out with that. I know there's a drum company that normally makes like drum heads, and they switched to making face shields, and 3M started pushing out a bunch of the N95 masks and stuff. So hopefully that's something that you guys don't have to deal with. So you guys have been working there for a week. You probably came in a little bit before that. When are you guys planning on going home?
When COVID ends.
Oh wait, so you guys are literally there until this thing is done.
The three of us got our one-way ticket, and we don't know when we're going home.
That's quite a big sort of leap of faith, for lack of a better term, because we really don't know when this is going to end. I'd imagine that's very difficult for you and your families and things like that. Are you guys doing anything to sort of stay in touch with your families and stuff back home?
Yeah, I mean, I FaceTime my mom and my grandma every day to see my dogs, because those are my babies. But
I understand. So I have two dogs myself.
Yes, those are my babies. So really a lot of FaceTime, text messages every day to keep in touch really is the main thing for me.
For me as well, I think now since this, I've been talking a lot more to my parents and my siblings more than what I used to. So every day FaceTime. Same thing with my boyfriend. Just FaceTime every day. Yeah. I mean, good thing for the internet now.
Yeah, absolutely. Absolutely.
Because if not, we'd be writing letters in the mail and waiting.
Absolutely. Every day. You'd write a letter every day.
Yes, writing a letter every day.
Absolutely. So I know you guys have only been there a week, and I know it's a very stressful time at the hospital. So I like when we're doing these types of interviews to ask, like, how is the morale at the hospital?
Right now, you can tell that there are some people that are on edge with the work that they have to do.
Sure.
But as far as the camaraderie that we've seen has been incredible, especially the community support. People are restaurants are bringing in food for all these different departments. That's and awesome. Feeding everybody and thanking everybody. The other day, if you looked out any one of the windows at the hospital, somebody did chalk art and just thank you, hearts, and all over the parking lots. It's pretty cool. Most of the staff has been deployed to other areas of the hospital because the workload in their department has diminished, and volunteered. People are volunteering to go to other departments to work and to help out. So it's been pretty incredible seeing that every day.
I've seen a lot of stories on, just various news sites about that sort of feeling across sort of the country. And I know just from like being an outside observer, it's been interesting to see the chatter online going from like regular stuff like sports and entertainment to, look at all this great work that our healthcare workers are doing. And it's interesting to me, and really only because I work in the field that I work in, it's not a different mindset from the healthcare worker. The mindset of the healthcare worker is sort of always like this. I just feel like because of what's going on, public perception is now turning and seeing that. And I've been blown away by everyone's response to that. I think it's very awesome that instead of cheering on, NFL players or NBA players or, baseball or whatever, people are blown away by the awesome work that you guys are doing, because it is awesome and it's always been awesome. And I just feel like it was way underappreciated. And I'm so sorry it took a pandemic for that to come out. But I think it's been a great thing for us as a country to sort of see how valuable everyone at a hospital is.
Yeah, agreed.
Healthcare is just the epitome of selflessness.
It is.
And people that join healthcare is because they want to help others and they put others before them. And I just think that's what everybody does.
Right. And now everybody is seeing that.
And I agree with you that everybody sees that. And
yeah,
hopefully they'll take that into appreciate and do something about it once this is all over for those people.
And I do think it's always been that way. Of course, you would know better than me because you actually work in the hospital. But I think the mindset of the healthcare worker has always been that way. I just don't think that we on the outside have taken notice of that until this.
Right.
I just want to thank you guys so much for taking the time today, and really mainly for the work that you're doing. And I know you're super busy, and I appreciate really all three of you being willing to sort of jump on the phone here with me and just have me ask you these questions to tell me what it's like doing what you guys are doing, the way you're doing it, where you're doing it. So thank you guys so much.
Yeah, and thank you.
Absolutely.